I said I'm thirsty.
I don't want to do this anymore.
Jessica, she's got to be getting hypoglycemia.
I guess she is actually sensitive to insulin. Good test. Looks like I'm getting demonetized with that language. Now they're giving her insulin. Insulin actually lowers glucose unless you're resistant to it, which they thought this lady was, and she's clearly not since her blood glucose is plummeting faster than my crypto portfolio. Very excited to be reacting to House MD Season 1, Episode 16, Heavy. On this channel, we are reacting to all 177 House videos, and this would be Episode 42. Let's see if I can get the diagnosis before House does as a doctor working in London.
My chest.
Oh no.
How do you think the ground feels?
Hey, Seth.
Heart stopped. Start chest compressions. He knows. I was expecting just a bog standard run-of-the-mill faint, but we got a cardiac arrest in a 10-year-old. Very interesting way to start, but what's even more interesting is someone's finally doing chest compressions in a house cardiac arrest. I never thought I'd see the day. Now we know that she's a little on the overweight side. She was exercising when it happened. She had chest pain as a warning beforehand, and the heart stopped fairly suddenly. Causes could be ischemic, very unlikely in a 10-year-old unless she has familial hypercholesterolemia, and then she would have fatty deposits on the eyelids and tendons. It could be conductive, which is very possible due to sick sinus syndrome that causes the inherent pacemaker of the heart to just stop and then start again. There are genetic conditions like desminopathies that cause it as well, or third-degree heart block, but usually she would have had surgery already to have caused that, and it seems like she hadn't. Metabolic could be a possibility as well with abnormal potassium or toxic causes. If she's weight conscious, maybe she's been taking diet pills like hydroxycut, which I remember there was a case in 2018 where a lady had a cardiac arrest as a result of taking it. Definitely would fit the scenario. Let's get more clues.
You need to get rid of one of your people. You have a week.
10-year-olds do not have heart attacks.
That's what the ER thought.
3 CKMBs were positive. The EKG shows classic signs of ST elevation.
What? It was actually a heart attack. I find that almost as hard to believe as Heidi Klum's worm Halloween costume. Now, if what they're saying is true and she did have ST elevation, which is a very classic ECG that looks like this, that means they wouldn't have even waited for the CKMB blood test she was talking about, which tests for cardiac muscle damage. They would have gone straight to an angiogram to check the blood flow to the heart, the results of which would be very helpful around about now, but that would be too easy, wouldn't it? Also, the CKMB they were talking about is an older marker of heart muscle damage where the proteins spill out into the blood that can be detected. There is a newer test now called troponin, which is more sensitive and specific. Spicy causes of this could be a cardiac parasite, or my primary theory is still diet pills, which if it is correct would be very exciting, so you need to watch on to find out. Also, new hospital boss Vogler wants House's department to lose less money, so he's making him fire one of his staff. Which would you choose? Answers down below.
What about metabolic syndrome X?
To a hyperinsulinemic euglycemic clamp.
Why can't any of you doctors see past her weight? If diet and exercise are the treatment, then the diagnosis is wrong.
I do agree with the mom. Syndrome X, also known as metabolic syndrome, is a bad diagnosis here. There are some genetic factors, but not really that would cause the condition to present this early and be severe enough to cause a heart attack. I would be a bit more convinced by Cushing's disease, where there is too much cortisol due to a benign tumor in the pituitary gland that makes too much ACTH that stimulates the adrenals to produce cortisol. Cushing's disease is different to Cushing's syndrome, which just describes the effects of having too much cortisol on board, not how it actually got there. So Cushing's syndrome could be caused by having too many steroid tablets, but Cushing's disease couldn't. Hope that makes sense. Now, when the mother said, "Can't any of you doctors see past her weight?" she was touching on a very important point. Weight stigma in healthcare. There was an article in The Lancet on this very topic published in 2021 by a guy named Stuart Flint. It describes how many people with obesity face discrimination on a daily basis, and healthcare should be a safe space. Instead, obese people are disrespected, stigmatized, and in some cases denied equal access to care. This may not happen consciously and could be because of a lack of training and education to healthcare professionals in the complexity of obesity. That is, much of the medical community sees obesity from a biomedical perspective as an imbalance of energy intake compared to expenditure, calories in, calories out. In recent years, the socio-ecological view of obesity helps to better contextualize its complex problem. Processed foods are more easily available, have a longer shelf life, are generally cheaper. Some foods also have cultural relationships. Taking into account all of these factors is important when planning how to tackle the growing obesity problem worldwide. The hyperinsulinic euglycemic clamp is created to assess the tissue sensitivity to insulin by infusing it and seeing the tissue response. It isn't done much in clinical practice as the insulin sensitivity can be inferred from other factors like HbA1c levels, weight, and age. It's widely used in research, however, to assess the effect of an intervention.
It's like my heart is on fire.
Burning?
Exactly.
Sounds almost like heartburn.
So, can you give me something?
Like a thesaurus?
No wonder House has about as many friends as herpes, although not sure exactly how that would work. Definitely one of the only places that a long distance relationship is preferable. I love House clinic scenes and I've heard that you want to see more of them, so I'm including them here. There are quite a few causes of heartburn. In a woman of childbearing age, you'd want to rule out a later stage pregnancy. My wife was recently pregnant and was chugging Gaviscon faster than the shop could restock it. House is treading on such shaky ground here that he may have inspired the Squid Game bridge scene. This does remind me of a case in the UK of a lady who weighed 130 kilos and didn't know she was pregnant until 4 hours before giving birth. What makes it even worse is that she visited her doctor 10 times complaining of stomach pain and they didn't figure it out either. Now you know why we ask every woman of childbearing age if they could be pregnant. Seems like House is gonna sneak a pregnancy test into this blood test. Naughty.
I said I'm thirsty.
I don't want to do this anymore.
She's gotta be getting hypoglycemia.
I guess she is actually sensitive to insulin. Good test. Looks like I'm getting demonetized with that language. Now they're giving her insulin. Insulin actually lowers glucose unless you're resistant to it, which they thought this lady was, and she's clearly not since her blood glucose is plummeting faster than my crypto portfolio. It reminds me of this one time when I was in A&E and an elderly couple came in, husband with type 2 diabetes. He kept getting low blood sugar time and time again. The diabetes team was adjusting his insulin and he'd been to A&E about 4 times. I started speaking to him and his wife after correcting his glucose and she said to me, "I just don't understand it, doctor. His blood sugar goes low. I give him treatment, but it doesn't help. It just keeps getting lower." I say, "What do you give him?" She says, "More insulin." Well, that might be why it keeps getting lower. Insulin drops glucose, not raises it. That's why it's so important to deeply listen to our patients. I have a rule called the golden minute where I don't interrupt patients at the start of the consultation as they'll likely tell me the critical information I need to know in that first minute.
The blood tests show your daughter was not hypoglycemic, which means her psychosis wasn't caused by anything these doctors did. Diet pills can cause heart attacks and blood clots. Find those pills.
Oh, House is investigating my diet pill theory now. Exciting times. Seems like he thinks the rage was caused by a clot in the amygdala area of the brain, which is the fear, anger, and passion area. Strokes in that area can lead to excessive expressions of fear or anger, which we clearly saw. The clot would need to be tiny as it's only a branch of the anterior choroidal artery, a branch in the middle cerebral artery which supplies the amygdala. To treat, House is recommending heparin and warfarin together, which is not a good idea for a stroke. New evidence shows that full anticoagulation with warfarin or a less monitoring intensive medication like apixaban would only be needed if there were another indication like atrial fibrillation or deep vein thrombosis like a clot in the leg present. The current best treatment for a stroke like this would be high-dose aspirin 300 milligrams with stomach protection for 14 days, then switching to clopidogrel on its own long-term. So interested to find out what pills she's taking. Now, if you're interested in some exclusive channel perks, then check out the channel membership. Members can recommend a series and episode for me to react to, get priority reply in the comments, early access to new videos, and a spot in all giveaways. Right now, the first 30 members will win a chance to get a one-on-one medical tutor session on a topic of your choice with me. We have 11 members right now, so there are only 19 spots left. Those who join now will be known as early members as well, and the earlier you join, the earlier I can react to your suggestions. So click join down below to secure your spot for less than a price of coffee a month.
Hi, Edward Vogler. Is Dr. House claiming that I'm forcing him to get rid of one of you? I am forcing him. I just wanted you to know that my door is open.
Why is having a lot of money so easily associated with being evil? Look at Squid Game, Cruella de Vil, Mr. Burns, the Green Goblin. Vogler is another one on the list. It's no accident either, as in general society, we do not like billionaires. If you don't believe me, then look at this Reddit list rating some familiar faces. Now, I have a very different perspective. Money is a store of value, and self-made billionaires become rich because they provide that value to the market, usually by producing something on such a scale that changes the world. Easy example, NASA, a government-funded institution, couldn't make a rocket that could successfully land on re-entry into Earth. SpaceX did. That has the potential to benefit the whole human race. Some may not agree with all the methods to get there, but if the Earth came under attack, then I'm sure they won't be waiting for the next spaceship.
The tumor is extremely large, at least 30 pounds, but it's completely benign.
If it's not cancer, it can't kill me, right? I'll have a huge scar. I won't be able to wear a bikini.
30 pounds. 30 pounds! And she wants to keep it! Now is the time to tell you it's not a baby. 30 pounds or 14 kilos for the more European inclined of you may sound like a lot, but do you know how big the largest tumor ever resected was? 303 pounds in 1991, Stanford University Hospital. I love the accuracy here from House as well, because they said here it's a benign ovarian tumor, which is exactly the same type as the one that holds the world record. There's no picture of that one, but there is one of a 132-pound ovarian tumor from Connecticut that you can see here. An interesting thing though is that she asked Wilson if it could kill her, and he said no. That's quite a statement. Now, we know babies that weigh much less than what she's got cause compression of the inferior vena cava vein, leading to clots in the legs. So if you've got a large tumor causing a compression, then an abdominal scar would be a very good trade-off for your safety. Also, she's worried about a scar because she couldn't wear a bikini, and that is fair enough, but there's a chance they could do an extended phalansteal, which is a lower abdominal, like a C-section scar, and remove it through there, and then you could hide the damn thing under the bikini line. You just need to make sure it was extended long enough to be able to get a 30-pound tumor out, which shouldn't be too much of a problem.
I totally busted her for taking drugs one day. She totally lied, said that they were diet pills her mom had given her.
I took the pills. I took them from the store.
Please stop it, please!
Wow, well, we know she took diet pills, but that doesn't tend to make you bleed from everywhere. There are a few things that could cause this, but one of the most interesting is a condition called hematohidrosis. It's a very rare condition where you basically sweat blood. There are lots of causes of it, and it itself is more of a symptom than a diagnosis. Only a few case reports exist, but the ones that do suggest low platelets, vicarious menstruation, and severe stress as the causes. And when I say vicarious menstruation, I mean menstrual tissue that is active outside the uterus in the skin, leading to you bleeding through the skin. That is an insane diagnosis. Treatment would be of the underlying cause, and you could diagnose it by testing the fluid for blood using a benzodine test, as long as there were no open wounds once you wiped away the fluid on the wound surface. If the ooze was actually a wound, then the sudden nature of it would be concerning for toxic epidermal necrolysis, which is a life-threatening skin disorder that produces acute peeling and breakdown or necrosis of the skin due to specific drugs. Could it be, and this would be a very spicy diagnosis, that she has an allergy to one of the drugs they gave her, like insulin, heparin, or warfarin? Or could it still be excessive cortisol due to Cushing's disease, leading to the thin skin and the necrosis here? You definitely want blood tests for clotting and platelets, and a blood film to make sure there's nothing else going on too. Very interesting.
Diet pills don't cause skin necrosis.
Diet pills brought her to us. We gave her the sores. Warfarin-induced skin necrosis.
We did this? You know, I should probably talk to Dr. House.
I think I'm a bad person. I always seem to like the evil characters. The more badass, the better. Thanos from Avengers, Vogler here, Pain from the Bleach anime. Niccolo Machiavelli would approve of my ideas, as he thought that evil or not being nice were necessary for effectiveness, at least in 15th century Rome and for politicians. He also did say that it's good to have some mercy and only perform beheadings at night. So kind. Well, it seems like Vogler is ignoring his advice, since he is going straight for House's jugular during the day, trying to split up his team through divide and conquer one by one. I love this episode. Also, drug reaction, diet pills. I think I'm doing pretty well on this episode so far.
You're your own man. And yet here you are working for a guy you can't stand.
I'm gonna cut the pay of all four of us to keep us all for the same amount of money.
No.
Are you talking about cutting off my daughter's breasts?
Cut off her breasts. Cut off her breasts. Okay, this episode is actually bonkers. Now, the reason why, as Wilson explained here, was that warfarin-induced skin necrosis has a predilection for the breast, and so cutting them off would stop the progression of that necrosis if medical treatment isn't working. Now, in reality, that is nowhere near a viable treatment option, although it makes for amazing television. We saw that areas of skin necrosis, they weren't on the breasts, and if they were, I would be demonetized again right now. The sores were so widespread on the chest that cutting them off wouldn't be a viable option. Now, you may be wondering how warfarin could even cause this. It is an extremely rare complication which happens in only 1 in 10,000 people who get the drug, and is more likely in those with a predilection to clotting. You see, even though warfarin is a blood thinner, it actually causes clots when it's first given. That's why it's usually bridged with heparin, which thins the blood immediately. Chase and House blaming Cameron for accidentally giving warfarin instead of heparin, but that's pretty much impossible. Warfarin is a tablet, heparin is a subcutaneous injection. If you could mix those two up, you need your eyes tested, a frontal lobotomy, and probably a few hours on the naughty step with no dessert.
Cute kid. Love her green eyes. Of course, since both you and your husband have brown eyes.
Where'd you get that?
From the father of 3, maximum 4 of your 6 children.
Loving the House detective here, but the House doctor here is about as accurate as flat earth theory. 2 people with brown eyes can have a child with green or even blue eyes. Now, eye color is determined by a multitude of genes on chromosome 15, mainly the OCA2 and HERC2 genes, but some others play a part. These genes code for the amount and saturation of melanocytes in the iris, which is the colored part of the eye. Large amount of melanocytes, brown eyes. Medium amount, green eyes. No pigment, blue eyes. For inheritance purposes, you have 2 copies of the eye color gene, one inherited from your mother, another from your father. You can think of brown genes as being dominant over green genes, which are then dominant over blue genes. Now, the most dominant gene present will produce that color. Brown-blue makes brown. Brown-green makes brown. Green-blue makes green. Blue-blue makes blue. But what's interesting is that even though green genes are dominant over blue genes, green eyes are actually much rarer, with only 2% of the world's population having green eyes, whereas 8% have blue eyes. Now, a question for you smart people. If blue eyes contain no pigment, then what gives them their blue color? Answers down below.
She's fat. I mean, what if it's not a cause? What if it's a symptom?
Okay, so what could cause obesity and skin necrosis?
Oh, very interesting now that Cushing's disease that I mentioned earlier could be the cause. Other possibilities include hypothyroidism, growth hormone deficiency, or polycystic ovarian syndrome. I would definitely want an early morning cortisol, thyroid screen, testosterone levels, and sex hormone binding globulin levels. Would also want to check her height and see how it's progressing compared to her expected growth velocity, and buy myself a trophy in case I got the diagnosis right. Quite exciting.
Hypothyroidism?
Genetics are more likely. My mom's heavy too.
She's tall. You have any history on the dad?
6'1".
Kid's short. We got stunted growth.
This is looking more and more like cortisol excess or Cushing syndrome. I suspect it could be due to Cushing's disease, which is a pituitary gland adenoma producing ACTH, which can cause high cortisol. But other causes of Cushing syndrome are taking too many oral steroids like prednisolone, or a tumor elsewhere like in the lungs, pancreas, thyroid, or thymus that is secreting ACTH as a paraneoplastic syndrome. Could also be adrenal adenoma. I'm itching to find out here.
It's Cushing's. This Cushing's can cause hypercalcemia, which can lead to the same skin necrosis as warfarin. It's perfect. It explains everything. Let's do an MRI.
Yes, I came up with Cushing's about 7 minutes into the episode. I will take that, but not time to celebrate just yet, even though I already have. Let's see if we can treat her first and save those breasts, which the team want to chop off for some reason. We also haven't confirmed the diagnosis yet. Now, House was saying that the cortisol levels were normal, but that's because there is significant variation in cortisol throughout the day. That's why we always do an early morning cortisol. There would also be some metabolic side effects of generally high cortisol because they have glucocorticoid effects, which could cause the symptoms we've seen here, but also mineralocorticoid effects. The latter causes more sodium to be resorbed from the kidneys at the expense of potassium excretion, which we would see on the blood test. Also, there has been some interesting interactions between Chase, Cameron, House, and Vogler. Chase has been feeding Vogler information. Cameron thinks House is gunning to fire her because he can't handle his feelings for her, which he didn't admit. This is a very interesting episode. Quite fun.
Nothing on the adrenals.
Back to the pituitary views. There.
A tumor.
It's Cushing's.
Wait.
They found it! See? It's not exactly brain surgery. Wait. The good thing about this now is with the tumor out, technically it's completely curable. What you'd have to be very careful of though is damage to the pituitary gland from surgery. You see, the pituitary doesn't just help produce steroid hormones, it also is in the cascade for sex hormones, growth hormones, fluid balance hormones like ADH, thyroid hormones, and even controlling pigment levels through melanocyte stimulating hormone. If the pituitary gets damaged, you can get a medical emergency called Sheehan syndrome. The most common group it is seen in is after labor, where so much blood is lost from childbirth that the blood flow to the pituitary stops, leading to a tongue twister of a word, postpartum panhypopituitarism. Try and say that a few times. Great episode so far, very much enjoying it. 8 out of 10 entertainment, 7 out of 10 accuracy, 9 out of 10 diagnosis. House is just so good.
Jessica.
Hi.
You look fantastic.
She always looked fantastic.
Chase.
Chase stays.
Oh, Vogler is playing some games here. Seems like this is all a power play to stamp down his authority. I have to say, I'm not liking him anywhere near as much as I did before. Also, Chase did turn his back on his colleagues. Loyalty is very valuable in this world, and it's important that we stay true to our morals, especially in tough times. Anyone can be true to themselves during easy times, but you see people's true nature during hardship. This episode is good, but only really starts to make sense when you watch the previous one where House treats a member of the mafia who has a secret. So check that out here. I'm Sermed, stay curious.